Good afternoon and welcome to Nursing Chat. And these are your hosts. I'm Adelaide Williams.
I'm Chris Putter.
I'm Sarah Wright.
And I'm April Seamster.
Today we will be talking about two nurses, Alyssa Morris, age 22, and Heather Gowan, age 44, that were arrested on December 5th, 2022, each on two charges of intentional neglect of two vulnerable adults between September 9th through 11th of 2022. Both women were working as LPNs at Magnolia Manor in South Carolina, which is a skilled nursing facility. They knowingly and willfully failed to provide care that was needed for safety and health purposes to two clients. The things they failed to do were wound dressing changes, which caused the wounds to increase in size and causing risk to overall health. These charges are felony charges and have the potential of up to 5 years in prison. As of this current day, both of these LPNs still have their licenses and they are unrestricted. According to the South Carolina Attorney General, no formal charges have currently been placed.
There were ways to prevent this. The nurses could have managed their time more efficiently to get tasks done. They could have delegated these tasks to other aides that were appropriate, and they could have prioritized these wound dressing changes maybe in the beginning of the shift.
According to the American Nurses Association, the code of ethics was broken in many counts. One thing that the nurses broke was Provision 6. Provision 6 is the nurse through individual and collective effort establishes, maintains, and improves ethical environment of the work setting and conditions of employment that are conducive to safe, quality healthcare. These nurses did not provide ethical healthcare or quality and safe healthcare. They broke Provision 6.1, which is the environment and moral virtue. They broke 6.2, which is the environment and ethical obligation, which focuses on what is good and bad in regarding to whom we are to be as moral persons. Ethical or Code of Ethics 6.3 was broken as a responsibility for healthcare environment. The nurses did not provide ethical care as they did not take care of these wounds. A nurse in 6.3 should address and concern healthcare environment, and no one else stood up to say anything.
A joint investigation by the Spartanburg Police Department and the SCMFCU revealed that between September 9, 2022 and September 11, 2022, while employed as licensed practical nurses at a skilled nursing facility in Spartanburg, both Morris and Gowan are alleged to have knowingly and willfully failed to provide the care necessary to maintain the health and safety of two Magnolia Minor residents. Specifically, the SCMFCU charges that both defendants intentionally failed to change the victims' wound dressings, causing their wounds to increase in size, resulting in both victims suffering unnecessary harm and risk to their physical health. During the time of the alleged misconduct, the victims were classified as vulnerable adults under the South Carolina law based upon their residence in a residential or skilled nursing facility.
So, just going off of what April had spoken about with the rules broken, I had actually watched a video by Nurse Liz, who's a registered nurse. She was kind of discussing about how it went up the chain of command and then back down for how it was reported. So the nurses, most likely didn't do appropriate documentation, and then they were still charging for those dressing changes. And Medicaid was most likely doing an investigation on them or just a standard audit, and they had questioned those charges and the charting not matching up. And then, so as a way for Magnolia Manor to cover themselves, they went ahead and placed charges on those nurses, which honestly I think is not very moral. Adelaide?
Yeah, I think that Magnolia Manor definitely needs to think about some initiatives. So, Wound Care Collaborative Community.org has initiatives. They have basically initiatives just based off of wound care. And I think that number 3 would be great for them. They just need to develop standards for clinical and scientific evidence in the wound healing community. growing access to diverse real world data sources, and enabling new approaches to close persistent evidence gaps about optimal use of medical products in real world practice in many areas of medicine. Whether this happened because they were understaffed or, thinking about those real world data sources could definitely help close that gap. And then Magnolia Manor isn't putting things on nurses that, even though yes they made the choice to not take care of the wound dressing, whether they had other things going on, that just helps alleviate that. And then also the Joint Commission also created some initiatives for national patient safety goals that I think that Magnolia Manor could take in. So, under their initiative, Healthcare Equity, which is NPSG.16.01.01, it is just improving healthcare equity for the organization's patients in equality and safety priority. When you're taking care of your patients, I think it's really important that Magnolia Manor helps make sure that there is quality care and that they are managed or prioritizing safety.
I think some other initiatives that they could include are just basic ones. So when you do a dressing change, put the date and time on there so other people looking at it can know. And then just communicating better with your incoming shift about what is done and what's not done for the day. And then figuring out what you can delegate to others to help a more steady flow of work go.
Like I said earlier, I wanted to touch more in, or I wanted more information in on what actually went on during that shift, and what led up to them making the decision not to give that wound care. Did they not have supplies? Was there a code on the floor? Um, was the resident not even physically there for them to do the wound care?
Yeah, and that is one of the big problems and kind of scary to think about when it comes into the nursing profession is staffing ratios. Most states don't have laws protecting us against, being given too many patients. And a lot of what, in my experience, I've heard from different nursing care employees is, especially in skilled nursing facilities, they can have ratios of 30, 40, 50 to one nurse. It's just insane. There's no way to be able to safely and effectively take care of that many patients.
Mm-hmm.
Agreed.
Or they could have, started that wound change and decided maybe this needs to be debrided. Maybe the doctor needs to see this before I move further. And they didn't get the opportunity to document, or they made the call to the doctor and the doctor never got back to them.
And this is all speculation, of course. We don't have enough information on this, enough reliable resources. So it's just kind of going off of what we can see and our life experiences based. And according to Nurse Liz, like I had brought up earlier, she had discussed about how these nurses could have protected themselves in their charting. I mean, if they honestly couldn't have gotten it done, they could have charted, inability to complete tasks due to staffing, unsafe work environments, staffing ratios, and that could have saved them in this instance. So.
And you can always submit, you could always submit to whatever your state board of nursing or whatever, I am in a working condition right now where I'm not able to take care of all of my patients, because Magnolia Manor did put it back on the nurses. And like we said, we don't have enough information. So whether they were genuinely, doing this intentionally or they didn't have time, no one knows, because it wasn't documented. There wasn't anything reported, and they could have protected themselves with that.
Yeah, and there's always the option to, when you come on to shift before clocking in, if you see that your ratios are insane, you don't have to take that team. You don't have to clock in because it's your nursing license. You might lose your job over it, but in the reality of things, you can still get another job if you still have a license. You've got to think of ways to protect yourself, because sometimes companies aren't always looking out for the best interests of their employees.
Right. And most employers have, like you said, stopping, like a seize protocol. If staffing ratios aren't safe, they seize what they're doing and call in other people or other resources. There's other things and other people they can call in to help at the moment, manager, other staff that can come do things that aren't nursing related, like ancillary tasks and stuff.
Yeah, actually, at the hospital where we work, there's that code. I think it's yellow. For staffing shortage, it's a staffing emergency, so that they're able to get those resources and call people in and provide extra pay and things that can, help us become more safe and improve those patient outcomes.
Those nurses could also provide more insight into how this incident was reported and why it was reported by the facility staff and not the doctor or the nurses that came on behind them or even the DON. This was reported voluntarily by the facility to the state and not by any other entity that took care of that patient.
It's like they didn't follow a chain of command to report it. They just attacked the nurses immediately before they had to take responsibility for this.
So, honestly, I think my biggest takeaway from this whole situation and everything that we've learned is you've got to protect yourself and your license, and you need to do what's necessary to keep you going so that you can keep caring for these patients. So, if that means you have to work at another facility, try to find one that actually has staffing ratios.
I think my biggest takeaway from this is make sure you're documenting everything. So when it comes to this, you're able to refer back to that and to be able to give yourself some lead on why it didn't get done.
My biggest takeaway is just maintaining your moral, ethical obligations and how you see the situation. Whether you're got 40 patients and you're understaffed, at the end of the day, you have to protect yourself, but you also have to protect your patient. So whether you include in your documentation or in your nurse handoff report, like, hey, I didn't get this dressing change done, the patient is also the priority and their safety is as well.
And then I like Chris's takeaway as well with the protecting yourself, but I would aim towards malpractice insurance to protect yourself not only from your mistakes, but to protect you from mistakes made by the facility or the hospital or wherever you're working so that they can't point that finger at you.
All right, guys. Well, that was Nursing Chat. Thanks for listening, and please let us know your opinions in the replies.